Back on MorningLine, we're talking this morning about the measles outbreak and more direct connection, and it gets into the debate of vaccines. Our guest is Dr. Michelle Fiscus, Medical Director at Tennessee Immunization Program. We bring up vaccines. I'm not doing this show about whether vaccines are good or bad. I believe the consensus, what I happen to agree with, is that they are good. But there are those who don't believe in them, all right? And, you know, I guess we were talking during the break about why, again, I'm all for freedom of choice and almost everything. I don't want to tell a parent how to raise their child if they object. On the other hand, they are being told if you go to a public school. But again, to talk about what we were saying at the break about the public health issue, that it's beyond just that family.
Right. So, you know, let's take, for example, the Washington outbreak of measles. So there's 38 cases as of last night when I looked of measles in Washington.
Yeah.
None of those people have been shown to have received MMR vaccine at this point. So there's a couple of cases where it's unknown.
Yeah.
But the vast majority of those are unimmunized against measles. And so if that international traveler who came in and got that infection going had come into a community where everyone was vaccinated, the chance of that taking off and becoming an outbreak is very, very small.
Okay.
But when someone comes in and infects someone that has access to a population of people who have not been vaccinated, then that's where we start to see this tip off like wildfire. And because each one of those people who becomes then infected has the ability to infect a circle of people around them, who can infect a circle of people around them. When vaccine rates drop below a certain threshold, it becomes very difficult to stop an outbreak. And what we have to do is go in and do emergency vaccination in those communities. And so, for example, when there was an outbreak of measles in Shelby County a couple of years ago, the cost of just the outbreak response was over $4 million because there was a pocket of folks that had not vaccinated. So not only is there, you know, a fiscal
yeah, it's a lot of money, taxpayer dollars,
bill to the state for having to do that, to have that response, it is way less expensive to prevent disease, any type of disease, on the front end than it is to try to react and contain it after the fact.
Okay. I just want, aside from those who maybe object and consciously choose not to, are there barriers, financial barriers to some, and then are there some maybe that just, if they don't go to doctors regularly, would like to, but don't even realize they need it? I'm saying, what groups are there besides those who just object to it and don't want to do it for their families? Okay, we know where they stand. But the others, should everyone, if you need it and want it, can you get access to these vaccines if you can't afford it?
Cost should not be a barrier to getting a vaccine. So all 95 of our health departments all 95 counties, we have more than 95 health departments across the state, have vaccines. And so if you're an adult who is uninsured, doesn't have access to health care, you can go to your local health department and they, free of charge, can give you a vaccine against any of these routinely recommended illnesses that
Not just the flu vaccine, but measles and others. And if there's, in the unlikely event, though, if someone, how would a parent see if a child, how does it manifest itself if your child gets the measles? So
children generally will come down with fever and very red eyes and what's called coryza, which is runny nose, but it is a fountain of runny nose. And then within a couple, 3 days, start to have this pink dotty rash that starts at the hairline and works its way down. These kids are sick. I've only seen measles one time in my practice because of vaccines, and that was a child who came from an endemic country, who left here as an infant, went to an endemic country, came back, and showed up in my office for their 9-month well child checkup, actively infected with measles, and it was one of the sickest children I have ever seen. So this is not going to be a child who's running around the house playing and maybe has a little runny nose and a couple of dots.
You'll know this is something you haven't seen.
Kids,
and again, measles, virus, bacterial?
Virus.
It's all viral. Okay. And
so it's really important for our listeners to know that, you know, first off, we don't have any cases in Tennessee, which is great. We want to keep it that way. So it's really important, if your child's not vaccinated and they're eligible, that they be vaccinated vaccinated. Secondly, if you think your child may have measles, you need to call your doctor or your health department or your local emergency room. Do not take that child in, because that exposure then, if they did have measles, exposes everyone in the airspace around them.
That's the larger issue. It's so easily spread.
That's right.
And that's where it becomes this big public health issue. And by the way, since it is a virus, that very sick child you were just talking about, you can't hit it with antibiotics. So all you can do is treat the symptoms and hope that child just gets better.
That's right. So the #1 cause of death for children with measles is a measles-associated pneumonia.
So their lungs fill up with fluid as a result of this?
With inflammation, and yeah, it becomes difficult to breathe. And so about 1 in 20 kids that are infected with measles will develop pneumonia associated with that. But you're exactly right. Antibiotics don't fix this. All we can do is support them, give them fluids, treat their fever, try to make them comfortable, and support them with life support if it should come to that. But about 1 to 2 out of every 1,000 kids who are infected with measles will die from it.
Wow. All right. Someone else, interesting question here. She says that she had the measles vaccine 3 times in the last 10 years because they tell me I'm not immune every time they do blood work. Why would this be?
So there are a very small number of people, and I wonder if this is maybe a healthcare worker, because we would be checking titers sometimes in healthcare workers, who don't develop antibody to the vaccine, and we don't have a clear understanding for that. But they, when we give a vaccine like measles, you give a weakened strain of measles to someone so that their immune system sees it and they develop an antibody to that, so that the next time they see measles in real life, they see it immediately, they react, and they wipe it out.
They're ready to fight it.
There are some people who have immune systems that, for whatever reason, do not respond to that vaccine, and right now there are not multiple different types of measles vaccines where we could try a different one. Kind of a similar situation, there's a hepatitis B vaccine where we give babies hepatitis B vaccine at birth for a couple of different reasons. One is that sometimes mothers are infected with hepatitis B, and that can be transmitted to their baby. And also because hepatitis B is one of the biggest causes of liver cancer. And so if we immunize babies, then we could potentially wipe that disease out, similar to we did with smallpox and polio and a lot of other diseases. Some people don't respond to, don't mount immunity from that hepatitis B vaccine. There's now a new hepatitis B vaccine that is much better and can help those people who maybe didn't develop a response to develop a response. That's particularly important in healthcare workers.
It's just the bottom line on a lot of this, as you say, vaccines, they're not perfect, and they've evolved over time, okay? But you made the point again about smallpox, and it's if you wonder, does it work? And there's going to be some who still will object to it. But smallpox, they stopped vaccinating for it in 1965. I got a smallpox shot. I was born before then, and smallpox is horrible. It's on par with measles and worse. It kills people. Smallpox now has been eradicated, not just in this country, but around the world. And it's not that those little smallpox germs just rolled over and died on their own. That is a direct correlation to vaccines, not just in this country, but I assume around the world. The only place you can find smallpox now is in the highest security lab, where it should be held, because who knows down the road, at the CDC.
That's right.
That's it. But it is gone. And smallpox killed thousands and thousands of people.
That's right.
And it is gone now. And the only reason it's gone is vaccines.
That's right. Well, even polio in the 50s. My parents remember lining up to get the polio vaccine when it first came out. That was the old oral polio vaccine.
Oh, I remember. Right.
So,
I took it.
Lots of people died. They had the old iron lungs. There were still people around who were paralyzed from polio that are still living today that can very much remember that. But we don't see that in this country now. We don't see it hardly anywhere in the world now because of that vaccine, and I mean that's undeniable that that vaccine has had a tremendous impact on reducing that. Now, in the case of measles, there are still 89,000 deaths a year around the world from measles. We haven't had a death in the United States, at least not in Tennessee here recently, but it is there. It's a global world.
Okay, but again, elsewhere, but not here.
But not
and
here.
the reason is very simple. Why?
because we have a very high vaccination rate.
Okay, so if you're wondering, well, vaccines don't work, it does. I mean, 89,000 people are dying around the world from measles, and we don't have that. I hope the folks in Washington and New York survive. I don't know if there have been fatalities there from that yet with these outbreaks.
I haven't heard of any
fatalities. I hope they survive, but it's like, that's just an undeniable point, as Paul is stating there, that, you know, it makes a difference there. Is it perfect? Is it for everyone? Guess not. I mean, there's a line where you can only go so far and tell parents what to do. If they want to go to public school, they have to do it. But otherwise, I don't know how else besides educating, because, again, a parental right trumps all, I would imagine, as long as you're doing something legal.
Right. So, yeah, you know, and there are states now that have taken away philosophical and religious exemptions to vaccines. So you have to have a medical exemption. California did that in 2016. They passed that law. And as a result of that, their vaccination rate went up by 4.5% in just a year.
You believe that saved lives?
Oh, if their vaccination went up by 4.5%, I mean, given the measles outbreak in Disneyland a couple of years ago that infected many states, you know, there's a great chance that saved lives. You know, it's very difficult to prove what didn't happen as a result of a change. But when you have vaccine rates that are declining in England now, they're getting into the 70%. We really need to be in the mid-90s of percentage of people who are vaccinated to stop these diseases. We're seeing more and more outbreaks in England as a result of that decision.
Well, Dr. Fiscus, I hope we at least educated some folks. I know we didn't convince everyone, and again, people have their points of view, but it is a public safety issue, and it's a personal issue. God forbid if my son hadn't gotten the shot and died of measles. Thank goodness for vaccines. Thank you, sir, ma'am, for coming on, and we'll see you again anytime you want to talk about this. We'll take a break, be back with a programming note, wrapping things up right after this.